Dr. Rodney Nash, here again with Dr. Christy Hewling and Kirk Hewling. I'd like to talk to you now about Achieving Biosciences and about what our goal is in our project to help breast cancer. We're focused not just on breast cancer, on various cancers, but I like to focus at this point on breast cancer, specifically triple-negative breast cancer, which is a type of breast cancer where there's no specific or exclusive treatment for. The treatment varies depending on what the clinician determines as far as your test results. We have worked previously with other cancers where we've been able to identify different biomarkers, and we like to do the same thing with triple-negative breast cancer to establish a library to help drug companies develop drugs, to develop specific drugs that are based off of the genetics of each patient, specifically the ethnicity of patients, because we know different drugs work differently in different people. And as we've discussed previously, the different demographics exist, and we don't necessarily know what we are. We're an amalgam of different ethnicities, and knowing can help drug companies develop better drugs that are specific to each individual and not as toxic, and hopefully cure the patient and have better results. So we are looking for clinicians to collaborate with volunteers and also financial donors also to help build this library of genetic material from patient tissue. So I'd like to, at this point, turn and talk more to Drs. Hewling, Christy Hewling and Kirk Hewling, about patients getting exams, about patient diagnosis, and having an overall positive outlook on one's health.
Well, as a survivor of breast cancer, it's very important that women are all screened and you follow up with your doctor so that you have your mammograms and all those things to make the diagnosis quickly. It's important to have donors, female donors of just all different backgrounds, participate in the study, because we know that as minority women we're underrepresented in a lot of studies, and by donating some of the tissue it really helps to build a library that can help in your own treatment, help a family member, other women that you know in the future. And it's a really interesting new concept for breast cancer treatment, but the only way that it can be successful is if we have the donors that will help and participate in the study. It's a great endeavor and something that I think can help future generations.
As a family physician, I speak to patients all day long about their health, about preventive measures that they need to take in order to ensure that they get all the years that are in store for them here on this planet. So, you can cut those things short with the behaviors that you take. It's not all, just bad genes, but genetics play a huge role, and researchers like Dr. Nash are trying to hone in on the things that they can do to manipulate genes in order to help you survive longer. But bottom line, you have to be an advocate for your own health. You have to do the research and find out what options you have out there for yourself when things go wrong, when you're diagnosed with something that is threatening to take your life. But even before all of that, going in and getting your breast exam, getting your mammograms done, colonoscopies when it's time for those, and even when you're in your early, teens and 20s, having just this routine that you yearly go in and get your checkup to make sure that heart disease is not looming, because that's the #1 killer. So you don't know if you don't go and check it out. And I've seen people take better care of their pets and their dogs sometimes, and it's just interesting, because as busy as you are, you can't do anything without your health. And that company you're working for, well, if you can't do it anymore, they'll get somebody else. Sir, ma'am, make sure you go and see your docs every year and get your preventive screenings done. And that's my message to everyone. I'm here to help you through as your primary care physician. but help is all I can do. You're in the driver's seat when it comes to your health, and going to get your preventive health screenings done is key. I'm Dr. Kirk Hewling. I work at Town Lake Primary Care in Woodstock. If you need a doc, call my office at 678-445-0819. Make an appointment. I'll be happy to take care of you and be that advocate with you in this journey that you're on for good health. Thank you.
This is Dr. Rodney Nash. I thank you for tuning in, and please look out for our next episode. Thank you.